Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
Welcome back to Life Unrehearsed. I'm Matt Del Vecchio, specializing in life transitions, elder care planning, and the senior living industry. Welcome to our segment called Helping Mums and Dads. In this segment, we try to provide guidance and support to the sandwich generation. You know, those parents, individuals taking care of their kids, themselves, and perhaps their parents as well. So we try to bring on some interesting and knowledgeable guests covering a vast array of topics that help families cope with the challenges of the aging process. This week is no exception, and I want to address a very hot topic, and it's the increasing use of cannabinoids for effective pain management. Now that cannabis has been legalized, there are increasing concerns about these so-called home remedies to deal with pain management. What are some of the potential pitfalls of that, and why are cannabinoids becoming so popular? Well, to help us weigh in on the subject, I'd like to welcome Dr. Michael Dworkin. Dr. Dworkin is the medical director and co-founder of Santé Cannabis. He's also an associate professor of family medicine and palliative care at McGill Medical School. Welcome to Life Unrehearsed, Dr. Dworkin.
Hello, Matt. Thank you for having me.
Well, thank you for joining us here on a Saturday. This is becoming an increasingly hot topic. I want to back it up a bit, Dr. Dworkin, just so we understand some of the terms and terminology. What is the difference between medical cannabis versus recreational cannabis?
Medical cannabis was legalized in 2001, and it aims at treating symptoms, management of many different chronic illnesses. Recreational, on the other hand, which was legalized in 2017, is mostly to get high, and as the word says, recreationally used for that purpose.
Right. You are very much involved with a lot of research and with many patients on the medical cannabis side of things. So can you give some examples, Dr. Dworkin, of some of the more popular uses of medical cannabis?
We're following more than 5,000 patients at this point in time. 70% or more have chronic pain, whether it's malignant or cancer pain, or mostly non-cancer pain, in fact, neuropathic pain, things like migraines and herpes zoster pain, etc. The rest of the 30% are anxiety, depression, insomnia, and more specifically ADHD, Parkinson's. These are very specific illnesses that we are trained to assess and treat.
And treat this with medical cannabis. And for our listeners, you talked about recreational cannabis, primary reason, really to get high. And now I want to get into the differences between THC and CBD, two very important components, and as well as ratios. So can you talk to us a little bit about the difference between THC and CBD?
Well, the two largest components of the cannabis plant are THC and CBD. THC is a psychostimulant, and CBD is not. That's the biggest difference. THC gets you high, and CBD does not. So it depends on how much of each you use to get the outcomes that you're looking for. It's important to know that CBD can relax you, and THC can help you sleep. So once again, knowing how to use these ratios in the individual patient is important. And trial and error is basically our approach. Start low, go slow, and see what happens.
You listen to Life Unrehearsed, Matt Del Vecchio, and we're talking to the medical director and co-founder of Santé Cannabis, Dr. Michael Dworkin. Dr. Dworkin, you mentioned the importance of ratios. Some people think, no, I don't want to get high. It could only be CBD, and yet there are some mixtures and so on. And mixtures come in different types and different forms for medical cannabis. Can you explain some of the more popular types?
Well, we start with cannabis oils, whether they're high THC or low THC. It varies on the coals, and we break through pain or break through anxiety or break through insomnia. We recommend vaping. So smoking is not recommended. Our basic approach is the oils will be titrated to a point where patients feel their results are acceptable and side effects are eliminated or minimized. And once you get that, you can use capsules, patches, creams, topicals, all kinds of other additional formats to get where you want to go. Bottom line, better quality of life.
And I think that's an important point related to that quality of life. And I'll dig a little deeper here. You mentioned the majority, 70% of medical cannabis is more related to chronic pain, the balance being anxiety type, assisting with that. Now, there are some cannabinoids that are very effective. It kicks in super quick, and others, I would imagine, like edibles, take a longer time to kick in. And so, for example, someone wants immediate relief. What is the best avenue for that?
Well, I think you have to understand the inhaled are the most rapid. There are some rapid-acting sprays that you can put under the tongue, which will work relatively quickly within 20 minutes. For the most part, our oils kick in within a half hour and last for 4 or to often 6 hours. So you can get a balance in terms of the daily routines and the needs, specific times during the day, how much you use of which particular format.
I understand. So, for example, the vaping might have a quick effect, but not long-lasting, whereas oils, you get a nice balance of relatively quick and longer-lasting, if I understand.
Yes, that's accurate. We just find it's easier to titrate the pain with oil to begin with, and then it's increased according to outcome and watching for side effects, which may be dizziness or sleepiness, dryness of the mouth, etc., so that you want to get the maximum benefit with the minimum of side effects.
You're listening to Life Unrehearsed, Matt Delvecchio, and we're talking to the medical director and co-founder of Santé Cannabis. That's Dr. Michael Dworkin. We're talking about medical cannabis and versus recreational cannabis. Now, I want to get into this sort of home remedy actions that are going on now that cannabis is legalized, Dr. Dworkin. So what are the risks of going to your local SQDC to buy a cannabinoid for your pain management?
Well, basically, the SQDC is a business that runs to help people maximize on getting high. There, people behind the counter are told specifically not to give any diagnosis or make an assessment of any sort. They're basically looking for various formats. And I didn't mention the edibles. They have edibles at the SQDC and drinkables. And so on and so forth. These things we don't use at Santé Cannabis. And we actually try to refrain from patients using those formats. SQDC will not be of service to you if you want to really target quality of life measures.
That's quite interesting. You know, you would think, okay, I'm going to go in. I'm just going to, like you go to a pharmacy, for example, and you're asking the opinion. So what you're saying is the employees at the SQDC, they're not even allowed to give advice for quality of life matters.
Correct.
Okay, very interesting.
But some of them will actually say, go to Santé Cannabis. And physicians have learned about our services, and they will direct patients to us with the appropriate referral forms, give us the information about past medical histories, a complete list of medications, so there's no drug interactions with the various cannabinoids that we offer and suggest. And then we can really follow these patients every 3 months and make sure that their care is optimized. Right. We have patients from all over Quebec, and we do a lot of our evaluations and assessments on the internet, and have good feedback from patients for this kind of supervised care.
Right, and talk about the feedback. We're going to continue our conversation with Dr. Michael Dworkin. You know, part of the challenge I'm sure that you're facing is the acceptance of medical cannabis, particularly for, you know, seniors, older generation might not be comfortable, doctors, physicians. Yet there are some very powerful stories that you're going to share with us about some of your own patients, how medical cannabis was certainly a better option than the heavy opioids that are being prescribed by some doctors. But first, Dr. Dworkin, we have to head out to our CJD Traffic Center. We're going to hear from Jill Fitzgerald.
Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
I'm Matt Delvecchio, and we're talking about the increasing use of cannabinoids for effective pain management with medical director and co-founder of Santé Cannabis, Dr. Michael Dworkin. Dr. Dworkin, we're going to continue our conversation Before the traffic, I had mentioned that part of the challenges is acceptance of medical cannabis as an effective tool in pain management, but it is becoming more effective. Unfortunately, opioids are still very much prescribed, perhaps too much. And I think you have a story of one of your patients, I believe it was a nurse, where it literally changed his life.
Well, this 40-year-old nurse had a work-related injury and had chronic back pain, so much so that he couldn't work at all for over 2 years. And his physician was only giving opioids to control the pain. And it wasn't really controlling the pain, only the side effects. He ultimately got a referral from his doctor to Sante Cannabis. We assessed the situation and came to the conclusion that a one-to-one oil would be the optimal way of treating this particular pain, which was quite complicated, and would help with his sleep, which immediately got better. We titrated up with the oils, and when his pain was acceptable, we don't say eliminated, because after years of pain, it doesn't go down to zero. When it got down to 3 out of 10, we started to titrate downwards on the opioids. This was done by the physician, of course, with our assistance. And ultimately, after several months of treatment, he could eliminate the opioids and was managing quite well with his one-to-one oil. He had better quality of life, activities of daily living, sleep, and he said he got his life back.
So interesting and so good to hear, because double benefit. He gets his life back. He's not on opioids anymore, and really good to hear. And we're hearing more and more of those stories. One of the challenges that I see, and some of the pushback, Dr. Dworkin, I work with seniors on a day-to-day basis, and the elderly are concerned. I hear a lot of pushback. Look, cannabis, it's just not accepted yet, and there's this nervousness. But you're seeing cannabinoids being used by the elderly more and more, aren't you?
Well, let's look at Quebec. Less than 10% of physicians in Quebec have ever, in fact, prescribed medical cannabis, and many of those are referred to us. We handle about 50% of all referrals in Quebec. The physicians look at this as complementary or alternative medicine, herbal medicine, and immediately they get turned off. This is not scientifically proven. This has no benefit for his or her patient. And this is the barrier, basically, that we see. And unfortunately, patients have a hard time getting a referral from their primary care physicians, if they even have a primary care physician. Mm-hmm. And then there's the basic fear that, as you mentioned, this notion of getting high and getting stoned, and what the partying kind of idea of cannabis, which has nothing to do with medical cannabis, as I mentioned earlier. This is where we can try to help patients really take control of their pain. Pain is not controlling them anymore. And by learning how to use the cannabinoids in the proper amounts and the proper strains, they can relatively quickly see the benefits, and all the other barriers are disappear, basically.
Listening to Life Unrehearsed, Matt Delvecchio, and we're talking to medical director and co-founder of Sante Cannabis, Dr. Michael Dworkin. And some of those elderly that I work with that have been using it are saying it's been very effective. Chronic pain management, insomnia, mood disturbances, even neuropathy. And I think you're seeing that day to day with your patients, aren't you, Dr. Dworkin?
Correct. You covered most of them. The older patients will have chronic pain because of degenerative arthritis, joint problems, and so on. And that affects, of course, their sleep. So they have both pain and insomnia. And if you have pain and insomnia for a period of time, you get depressed. And so it becomes a vicious cycle of all these difficulties in terms of functioning. Others have specific syndromes, such as after a stroke or after shingles. Diabetic neuropathy is something that we see a lot of. So all of this requires meticulous assessment and treatment with our team of nurses and physicians working meticulously to guide the patient to select the right products and get the maximum benefit to control these conditions. Remembering this is really a question of getting control, not cure.
Right. Now, you brought up an incredible stat. I'm still amazed. Only about 10% of physicians are suggesting medical cannabis. We've got listeners listening right now, and I screaming into the radio, how can I get medical cannabis? What are your suggestions to our listeners that want to try this?
Well, a referral from the patient to Santé Cannabis would be the easiest route. Other physicians might want to download the Health Canada information and directly order from the licensed producers, which are supervised by Health Canada. We all use the same licensed producers in Canada. The SQDC uses the same product. So the quality and consistency are universally optimal through Health Canada program. The physician will sometimes just say, look, I don't want to know about this. I don't know about this. Go see the experts, and we'll take care of it.
Right. Yeah. It's push, I guess, like you're saying, the physician and at least ask those questions. We're running out of time here, but I want to hear a little bit more about Santé Cannabis. You've put so much time and effort in it. And what exactly is Santé Cannabis?
Well, we didn't mention the research that we're doing, looking at the benefits of medical cannabis in various spheres of illness and health. We have 3 offices in Westmount, Kirkland, and Sherbrooke. As I say, we have patients coming from every corner of the province, from internet, online consultations. We have no shortage of patients. Actually, we are short of actually funds. We need money. Currently, we're having a fund drive to support more nursing educators at our work to keep up with the demand of patients. I think you'll be mentioning our website at the end of the talk.
Yeah, actually, let's mention that right now because we do have to wrap it up. What's the best way to find out more? Through your website, I guess, right?
Go to santecannabis.ca. You'll find out where to donate and all the information that you need in terms of referral forms. Some of us will actually take a non-referral patient, or patients who don't have family doctors who want to use our services can get in touch with us, and we'll guide them to the steps that need to be taken.
Great. All right. Dr. Dworkin, thank you very much for coming on Life Unrehearsed.
Pleasure. Thank you, Matt.
All right. That's Dr. Michael Dworkin. He's the medical director and co-founder of Santé Cannabis. You could look them up at santecannabis.ca. He's also an associate professor of family medicine and palliative care at McGill Medical School. Now, next week on Life Unrehearsed, holidays for the helper, how to not self-sacrifice your way to exhaustion, and a heartwarming initiative called Santa to a Senior, delivering gifts to over 3,000 seniors at more than 30 seniors' residences. We want to thank you for tuning in to Life Unrehearsed, and as a reminder, for all your inquiries or assistance with life transitions, elder care planning, and the senior living industry, it'd be my pleasure to help. Call me at Lianas Senior Transition Support, 514-622-8074, or just look us up at Lianas Senior Transition Support. Many thanks to our technical producers, Dan and Dario. Great job, Dario. First time on the board here, and you can listen to Life Unrehearsed here on CJD 800 every Saturday at 3 p.m.